If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, why do people with diabetes get polyuria? Answer by Joe Amagata. People with diabetes, especially type 1 diabetes, get polyuria because of abnormally high blood sugar levels. First of all, what is polyuria? As a medical doctor, I always start with the basics for a better understanding of what the topic is. Polyuria is when an individual passes more than 3 liters of urine in a 24-hour period. Polyuria is more common with diabetics, especially type 1 diabetics and poorly controlled type 2 diabetics too. A normal individual can have polyuria, albeit temporarily, if for instance, that individual goes on a beer drinking spree, as alcohol is a diuretic. A diuretic is something that makes you pee more than you should. Quite apart from getting drunk, you will have polyuria the more beers you drink. Now, in the context of a diabetic having polyuria, the mechanism is based on the goings-on in the kidney when blood with high sugar levels flows through the kidneys. Without getting too technical, the first stage of urine manufacture process when the blood flows through the kidney is called filtration. During this first stage, i.e. filtration, the blood flows through the nephron. Inside the nephron, there is some loss of efficiency in the filtration process because some useful substances your body needs are filtered through into the urine that is being formed. But worry not, because in the second stage of the urine manufacture process, these lost but useful substances are reabsorbed back into the blood. All of these activities are taking place within the nephron. The nephron is the functional unit of the kidney. Some of these substances that are initially lost in the urine that is being formed but reabsorbed back into the blood include amino acids, some ions, and glucose. In a healthy individual, all of the glucose lost in the first stage is reabsorbed back into the blood in the second stage. However, in a diabetic, the amount of glucose lost in the urine in first stage through filtration is so high, because don't forget diabetics already have high blood glucose levels, that it is impossible for all of the glucose to be reabsorbed. This is because the transport proteins that absorb the lost glucose back from the newly formed urine are overly saturated. The net result is, inevitably some glucose will escape in the final urine. That's not the end of the story, because glucose is a powerful solid. It means glucose has the power to attract water to itself by osmosis. So, if, as I explained above, do you lose a lot of glucose in the urine from excessive glucose in the blood coursing through the kidneys, that glucose in the newly formed urine will take a lot of water with it, i.e. lots of urine. Hence, a diabetic will pass lots of urine in a 24-hour period, which will qualify as polyuria. This is a very technical mechanism to explain, and I have tried to break it down in steps, and I hope I have done a decent job explaining this clearly. Incidentally, drug manufacturers have taken advantage of the second stage process by making drugs that will block this reabsorption of glucose process. In effect, if you lose a lot of glucose in the urine by blocking reabsorption using drugs, you also lower the overall blood sugar level. These drugs are called SGLT2 inhibitors. How good are these drugs? This remains to be seen, though. Talking about lowering blood sugar levels, you can do that also by improving your insulin sensitivity. How? Check it out here. Answer by Rohit Rajput. The most common cause of polyuria in both adults and children is uncontrolled diabetes mellitus, 2, which causes osmotic diuresis, when glucose levels are so high that glucose is excreted in the urine. Water follows the glucose concentration passively, leading to abnormally high urine output. In the absence of diabetes mellitus, the most common causes are decreased secretion of aldosterone due to adrenal cortical tumor, primary polydipsia, excessive fluid drinking, central diabetes insipidus, and nephrogenic diabetes insipidus. 2. Polyuria may also be due to various chemical substances, such as diuretics, caffeine, and ethanol. It may also occur after supraventricular tachycardias, during an onset of atrial fibrillation, childbirth, and the removal of an obstruction within the urinary tract. Diuresis is controlled by antidiuretics such as vasopressin, angiotensin II, and aldosterone. Cold diuresis is the occurrence of increased urine production on exposure to cold, which also partially explains immersion diuresis. High-altitude diuresis occurs at altitudes above 10,000 feet, 3,000 meters, and is a desirable indicator of adaptation to high altitudes. Mountaineers who are adapting well to high altitudes experience this type of diuresis. persons who produce less urine even in the presence of adequate fluid intake are probably not adapting well to altitude. Other causes of polyuria include: answer by William Schaefer, lack of insulin or ineffectiveness of insulin causes glucose to remain in the blood. It cannot enter some of the body's tissues, and continued introduction of glucose in the diet raises blood sugar levels. The primary form of carbohydrate transported through the blood is glucose, a simple sugar. Normally the kidney reabsorbs all of the glucose in the filtrate that eventually becomes urine. However, in the case of diabetes, the enzyme that does this job becomes overwhelmed by the amount of glucose in the blood and kidney filtrate, so the concentration of glucose in urine, normally 0, goes much higher. This disturbs the osmotic balance in the filtrate and urine so that it attracts much more water than usual, producing polyuria, or excess urine.